Hi, this is Danny with Skin Harmonics, the very first Medi-Holistic skin resurfacing method and skincare line. And today I'm going to talk about all of the different perspectives that different skin professionals have. And before I jump in, I have a few announcements. The first one is that birthday coupons are going to expire after 4 weeks of receiving them. So when you get them, use them right away. And number two, my friend, colleague, and client Emily Abbott is giving part 2 of her masterclass, Unveiling Beauty. Now, Emily is a pelvic health practitioner, so she brings a certain amount of depth and understanding to self-care, and we're going to go deeper into some more of the mystical and practical realms of skincare. So it would be so wonderful to see one of you or several of you there. And then number 3 is that I am still looking for clinical study participants. However, I'm looking for people that have acne specifically. And I'm also want to ask each of you that if any of you have before pictures of what your skin looked like before, perhaps if you could take a photo afterwards, matching the angle, matching the lighting as best as you can, and send those in, because if I can use them, I will say thank you with some skincare products, or perhaps some of my time if that's what you'd rather have. So please, if you took photos of your skin, have before photos, and know that you've been able to go through a really incredible transformation or some transformation, please email me those pictures. Okay, so now we are going to dive in on the different points of view, and I'm listing these out in no particular order, just as they have landed in my brain. So the first one is a laser technician. And a laser technician, their single goal is to increase blood flow. Like, that's their single aim. And the upside is that there is a short-term temporary improvement based solely on increasing blood flow. The downside to lasers is that there's a failure to address root cause. So that's a problem. And also their motto, the laser technician's motto, is more is better. More is better. And I will give the laser industry some credit for, over the last 5 or 10 years, reassessing the intensity at which they've been melting and going after skin with heat. And they're refining that, which I think is, a step in the right direction for sure. Most laser companies are coming out with gentle, not harmful, all of those things, but not quite admitting that they had done harm in the past. But they are moving in that direction, which I think is really good. However, they cross the line and are still a trauma-based treatment. Okay, so that's a laser technician. And an injection technician, their single goal is to disable muscle, which is Botox, and inject fillers for volume. So they're disabling and filling, and that is their single goal. They're not concerned with overall skin health, and they're just doing that. And of course, the upside is that there's immediate volume. There's immediately not relaxation, but comatizing of the muscle. And that counts for something. Now, the downside is that these injections decrease skin health over time. And I know that all trauma-based procedures justify their means by saying it stimulates collagen and elastin. We'll hear this over and over and over again. And yes, trauma does stimulate collagen and elastin. However, when you're weighing, when it's all said and done, was it worth it, in the long run? So their motto is never enough. Because the more you inject, the more you have to inject with filler. It stretches and inflames the soft tissue. You have to put in a little more, you have to put in a little more. And of course, with the Botox, it wears off, and then you have to relax the muscle more and relax the muscle more. Sorry, comatose the muscle. So the motto of that is like never enough. Like you're really sucked into a loop. So now let's move on to a plastic surgeon. So a plastic surgeon, their single goal is to remove excess skin and to repin lax muscle. And the upside to this is that it is the only real solution for excess skin. It's the only way to deal with it. And that's often very much worth it, even though the downside is that, and I have noticed this over many, many years, is that because they are removing and lifting the skin, it permanently interrupts that dermal epidermal junction and disrupts that capillary mattress, so that when it's reattached, the dermal layer, in my opinion, after seeing this for many years, before and afters, is just not as robust. It's been interrupted. And that dermal thickness and the ability for our skin to make new skin cells and circulate oxygen is diminished. However, like I said, it's still often worth it because of how it really is the only way to get rid of lax skin and to like repin, especially in this, in this area, to repin a lax muscle. So, and their motto as a plastic surgeon is the knife solves all problems. So, and they're looking at it specifically from that angle to address lax skin and lax muscle. However, it doesn't actually improve skin health. So that is a plastic surgeon. Now, a dermatologist, their single goal is to treat skin disease. Like, that's so much of their curriculum in school, is all of these rare and strange skin diseases, rashes, all of these skin disorders, the bacterial infections, fungal infections, severe allergies. So that's their main focus. And they throw in sun damage and acne as a side note to what they're doing. And it probably makes up the majority of their business. So the upside is they can treat those fluke problems. Like I mentioned, the bacteria, the allergic reactions, fungal infections, strange rashes. And then the downside is that there's a failure to address root cause. And there's this circling of traditional retinols, hormone manipulation, Accutane, and all of the typical harsh topicals, all the acids, benzoyl peroxide, astringents, all of that. And their motto, their motto is, let me see if I can remember it. Oh yeah, this is what I came up with, that their long-term goal is to meet your short-term goals. So all they're thinking about is how they can give you short-term goals and meet those. And so again, that's kicking the can down the road when it comes to addressing root issues when it comes to our skin. So now let's move into a medical esthetician. And their single goal is to adhere to the protocols laid out by a dermatologist. And that's the typical dry to fix and harm to heal approach. And to be good robots for the dermatologist. And I know this because I was recruited and groomed to do exactly that. And so the medical esthetician is exactly following out what the dermatologist can do, maybe with less intensity. And the upside is that there's a lot of personalized care from a medical esthetician. They're usually much more warm and caring than a dermatologist. Now, I know I'm just making generalizations, okay? So, yeah. So, but the personalized care from a medical esthetician is wonderful. And the downside is that, again, there's a failure to address root cause and getting stuck into all of that looping. And the motto of a medical esthetician is, well, science says so. Science says so. That's how they justify everything they're doing. The dermatologists, the industry told them it was science. And so they're going to cling to that. And we do need new proof and new clinical studies and new science. Like, that's my mission, to bring that forward. But it's a long road because we're up against a lot. And a holistic esthetician, this was the last perspective that I was able to think of. And the single focus of a holistic esthetician is to be gentle, is to be hydrating, is they all know about barrier restoration and natural, organic, all of those things. And the upside of a holistic esthetician is that they lean into all of the things that are preserving healthy skin. They're maintaining and maintaining and preserving healthy skin. Now, the downside to a holistic esthetician is that it's not corrective. There's no increased cell turnover ability with old school holistic aesthetics, because if we're not leaning into trauma, acids or scrubbing and all of that, then how are we getting new skin cells? So they're using more gentle things like enzymes and lactic, really, really soft lactic acids. However, there's no real ability to correct skin and increase skin cell production, which is how we can resurface and correct issues like hyperpigmentation, like acne, even rosacea needs some stimulation to heal. And of course, sun damage, all of the intense possible precursors that form, and, to really kind of roll back the clock and recapture youth and delay aging. So there's no corrective ability to purely traditional holistic skincare. Another downside to a holistic esthetician is that there's often too many essential oils. Like, because they can't use acids or astringents, or they're using gentle on that, they're going to go full blown into essential oils. And most of them are astringent and can overwhelm our system. You can get toxicity from essential oils. I know, because the first, 8 years of formulating, I worked with them extensively, and I got toxicity from too much of them. They're natural, they're exciting, and they're all different, and you want to just go into it, and you do, and I did, and learn the hard way that they cause a lot of rashes. They disrupt epidermal function when used continually. There's a whole slew of problems, and holistic estheticians usually, and I know I'm making broad strokes, love essential oils. So that's a downside. And their motto is less is more, except for when it comes to the essential oils. And that's pretty much what they think, like less is more. And that's good. Now, moving on to the last point of view, which is mine, which is the Skin Harmonics process, and a Skin Harmonics provider, which is me at this point. I do have somebody in San Francisco, and our single focus is we restore ideal epidermal function, which is a whole concert of things. It's balancing the sebaceous gland production. It's harmonizing and returning our skin to that symphony-like state where everything's working the way that it's supposed to be working. And of course, that's what I call self-cleansing skin. And it perfects texture and prevents the possible actinic precursors. Now, the downside to my method is that, actually, the upside, let's finish with that. The upside is that mine actually confronts root cause and turns it around and turns our skin into in the deepest possible way, optimal epidermal function. And it preserves healthy skin, it's corrective for acne, and it delays aging. So we have like all these yeses and all these upsides. However, the downside is that extractions can be painful, as many of you know. And this detox phase, though the extractions, once a year, right? But that initial detox phase, which is temporary, and it's on the way to getting to the place, right, where everything's humming along beautifully, it can be tumultuous for some people who have extreme cases, like deep, chronic, cystic and milia acne for years and years and years. It can be tumultuous. However, it works. If you can just hold the line and hold the path. Like, it's the only thing that will take you all the way there, and do it in a way where it's for real, and we're not just kicking the can down the road and putting band-aids and band-aids and band-aids all over all the symptoms forever. So that's a good thing. It's a very good thing. And the other downside of this method is that it does not increase volume. It retains and increases and maximizes dermal volume. However, it's minuscule compared to collagen, elastin, and the fat and the muscle in our skin. And because it's not injections, because we're not removing excess skin, because we're not inflaming the skin with temporary trauma fluid, the volume with this method can't be increased. Now, there is a way, in what I recommend, as many of you know, to combine my method with the holistic volumizing things like microcurrent, face yoga, maybe a surgical fat transfer. And there are ways to also use some injections too. It's a more nuanced. It's not like you have to choose, natural or trauma-based skincare. Like, it's not exactly that black and white. It's more like choosing the Skin Harmonics method first, making that your foundation, and then making intelligent decisions moving forward about all the other options, holistic and non-holistic. So, and the motto over here at Skin Harmonics is nourish to heal and hydrate to heal and play the long game. Just play the long game. So I hope that was helpful, and that I was able to just run through and summarize all of those different perspectives, because it is confusing. You go to one person, they say this. You go to another person, they say that. And because each profession has a different lens and a different perspective and different tools, that's how they're looking at it. And different training, that's how they see the world. And I've always been fascinated by exploring different perspectives. So I hope that all that made sense. And I think that is it. Happy Thanksgiving, everyone. And I am in Colorado for Thanksgiving. I will be back in California for Christmas and New Year's. And as always, I look forward to getting texts and emails and updates